Thank you for visiting this training video hosted by Gainwell Technologies. Today I'm going to show you how to enroll a new individual provider in the Provider Management module for Vermont Medicaid. Before we begin, please note that this video is intended for informational purposes only and does not guarantee approval of your enrollment in Vermont Medicaid. If you have questions regarding Vermont Medicaid's enrollment criteria, please contact the Provider Services Help Desk at 802-878-7871 or email us at vtproviderenrollment@dxc.com. For today's training, I'm going to start on the home page of the Provider Management module. You can access the link to the module by visiting www.vtmedicaid.com and click on the Enrollment tab. To begin a new enrollment, I'm first going to click on the menu button that's located in the top left-hand side of the screen. Under that, I'm going to hover over Provider Enrollment and I'm going to click on New Enrollment. The first thing that you are going to see is our welcome page. This page is designed to give you some more information on what you may need for documentation in order to complete your application. There is also an enrollment pre-checklist. This is not required, but again, if you want to get more information on your specific enrollment type, provider type, and specialty about the documentation and information you may need throughout the application, this is a good tool to find out that information. When you are ready, you can click Start to launch a new application. The first thing that we're going to do is we are going to register our new application. Every application that you process through the module has to be registered in order to obtain a unique tracking number, what we call a ATN or an application tracking number. This application tracking number can be used to resume your application if you can't complete it within a single setting or to check your enrollment status. So we want to make sure that we're registering each application as we begin here. So to do so, we're going to enter in an email and a password. And you do have the option to add a provider reference. This isn't required. Comes in handy if you are doing multiple applications and you want to be able to easily identify at the top of the page of the application who it is that you are working on at the moment. So this is just a tool for you, again, not required. Once you've completed the information, you can hit register. This has launched us into a brand new application. The first thing you're going to get is a blue box that has your application tracking number or your ATN, and it did send an email to the email that you registered with that tracking number as well. So you don't necessarily need to write it down or keep it at this time. It's going to follow you throughout the application and it will be in your email. So I'm going to click OK to continue. A couple things to note before we get started here. At the top of the page is your application tracking number, and again, it's going to be at the top of every page of your application. And then just below that is that provider reference that we entered. If you didn't enter any provider reference, this is just going to be blank. You're not going to see anything there. But if you chose to enter a provider reference, it will be underneath that tracking number on each page as you go through. There is page level help available, so if you want to learn more about the specific page that you're working on and you need some help, that is indicated here in the blue question mark. If you click on it, it's going to give you some more information regarding this specific page. And then there is also field level help. So if you need some help on a specific field, you're not quite sure how to fill it out or answer it, there is a gray question mark above each field. And if you just hover over it, it's going to pop up a bubble and it's going to give you some more information about that specific field. Anything with a blue asterisk is required, so you will need to make sure that you fill out each one of those fields before you're going to be able to move on to the next page. So to begin, the first thing I need to do is I need to select my enrollment type. So I'm going to select from the drop-down list here. And as noted earlier in the presentation, we are doing an individual application today, which means that you are an individual provider providing services as the billing provider as well as the rendering provider of those services. Now you'll notice when I selected enrollment type, I got a blue warning box. And this warning box is letting you know that once you save this first page of your application, you're not going to be able to come back and change your enrollment type. Your enrollment type and your provider type, once selected, drives the entire application. You'll notice that as well as bringing up this blue warning box, there's a whole bunch of pages back here that have populated once I selected enrollment type. We have tailored it so that you don't have to weed through unnecessary information. So once you select your enrollment type and your provider type and you save this first page, you're not going to be able to come back and change those two pieces of information. If later on down the application you realize you selected the wrong one, you would need to abandon the application and start a brand new one. So I'm just going to click OK. And then I need to select my provider type. So again, using the drop down, I'm going to be a physician today, and I'm going to get the same warning box letting me know again, once you move past this first page and you save the information, you can't come back and change your provider type. I also need to enter in a requested effective date, and you can request a date going back up to a year or up to 90 days in the future. So if you need a backdate request, you can go back to up to a year, or if you are looking to enroll for a future date, up to 90 days. The next thing we're going to do is select whether we're an individual or business, so you can toggle through each one of those. The difference here is going to be using a social security number for an individual or your tax ID for a business. This is just dependent upon how you want to receive those payments. So we're going to be an individual today, and I'm going to need to enter in my last name and my first name. Gender and ethnicity, those are not required fields, but you can choose to fill them out if you would like. I do need to put in a birth date as well as a social security number. And then I have to enter in an NPI, and the module is designed to recognize a valid NPI. So it understands that it must be 10 digits and that a valid NPI wouldn't be 10 twos or 10 eights. So you do need to make sure that you are entering your valid NPI into that field. Otherwise, it's not going to let you continue on. Under that, we are going to need to choose if we are currently enrolled as a provider. And if you choose yes here, you're going to get a red warning box that pops up. And this warning box is asking if you're actually trying to revalidate. So if you are already actively enrolled provider, it's wondering why you're submitting a new application. There could be a couple different reasons why you are doing that, which are perfectly valid. But if you are actually trying to revalidate, this is not the avenue to do so. So if I checked yes here that I am trying to revalidate, it's going to abandon this application and bring me back to the home page to do that. I'm going to click no so it stays here. And then if you are truly already enrolled as a provider, and maybe you're just trying to add a service location, you would need to give us your current provider identifier in the box to the right. I'm going to select no today, though, that we're a brand new provider. And then we're also going to ask if you were previously enrolled as a provider. Maybe you were in our network before and you're trying to re-enroll. So if you choose yes here, again, a box populates to the right and you're going to need to give us your identifier that was assigned to you before as a provider. And then lastly, we're going to ask you if you're Medicare enrolled. I am going to choose yes here. You'll notice that nothing populates on the right for me to fill out, but because I chose yes, later on in the application, I will be required to provide that Medicare information. And then the last thing I need to do on this page is I need to enter in the contact information for this specific application. There are a few different places in this application where we're going to ask for contact information, and each one of those is intended for a different purpose. So this one on the very first page is intended for this specific application. Who do we notify and who do we contact regarding this application only? So I'm going to enter in the name and address, and then you'll notice when I tab through the zip code, it is going to process through the USPS software to validate my address. and it is going to come up with a suggestion for a change. And it looks like here it just added the last four digits of my zip code. So I'm going to accept those changes by simply clicking on this line item. But if for some reason you did not want to accept the suggested changes, you can bypass that by Xing out, and it will keep the current information that you have. I'm going to enter in a phone type. If you have an extension or fax number, you can enter that here. And then you'll notice that email address is not asterisk, but just below the email address field is your preferred communication method. And you're going to need to tell us whether you would prefer us to send you notifications by email or mail. And I highly recommend that you choose email here. And the reason for this is that if you need to be notified regarding this application, maybe we need more information and it needs to be sent back to you, or something needs to be corrected, if you choose mail, there is a timer, whether you have email or mail, but there is a timer associated to getting that information back to us. And if you choose mail, it's going to be much slower and give you less time to get that information to us. If you choose email, the notification goes out to you right away, and you're able to turn around that information and resubmit your application. So we're going to recommend that you choose email here. And then you'll notice once I did choose email, now there is an asterisk on the email address, so I need to fill out that information. Okay, so I've gotten to the end of the first page and I can hit save and continue. However, before we do that, I just want to go back up and stress the importance of making sure that you have chosen the right enrollment type and provider type. Because again, once I hit that save and continue button and it goes to the next page, I'm not going to be able to come back and change those two pieces of information. I can come back to the page and change other pieces of information if I need to, but not those two. So I have confirmed that that is what I intend it to be. So I'm going to go ahead and hit save and continue and move on to the next page. So the next page of our application is the specialties page. And before we add our specialty here, I just want to note as well that you do have a progress bar here at the top. Anything that's blue means that you haven't gotten to that page yet or haven't filled it out. The page that you're currently working on is yellow, and any pages that you have completed already are white, and you do have the option to click back into those pages. What you're not able to do is jump from different pages. You do have to go in order here, so you wouldn't be able to click ahead and fill out pages out of order. So we do need to add a specialty related to our provider type. You'll notice our provider type is listed here. So in order to do that, I'm first going to click on Create New in order to open a new window and add my first specialty entry. You do have to make a specialty primary, so there has to be one that is your primary. So I'm going to click the Make Primary box to do that. And then I have to choose a specialty from the drop-down list. And this drop-down list is derived from the provider type that I chose. So that's why it's very important to make sure that you are choosing the right provider type in the beginning, because if you get to this step and you're not seeing your specialty listed here, there's a good chance that you did not select the right provider type. And if that is the case, you're going to need to start over and start a new application. So I'm going to select general practice for today. And then I do need to fill out and select a taxonomy. So again, I'm going to choose from the drop-down list, and I'm only going to see taxonomies that are allowed with the specialty I chose. And then lastly on here, I do need to enter in an effective date. And I do want to make a quick note about your effective date here. If you are requesting that you have an enrollment that starts in the past, so maybe you're asking for a date 6 months ago because you have claims that date back to that, you want to make sure that your specialty effective date also dates back to that enrollment request period, because you could encounter claims processing issues if you have requested an enrollment start date in the past, submit claims that are in the past, but your specialty only starts today. So just make sure that you are selecting the same date range that will cover that. Once you've entered in the information, you can hit save. And now you'll notice I have an entry to satisfy this requirement of a primary specialty. Now, if you have multiple specialties, you can simply repeat that process and add the other specialties. The only difference is you're not going to select to make primary because you already have a primary specialty. So only one can be your primary, but you can record multiple specialties here if applicable to you. If you have additional taxonomies to report onto your already reported specialties, you can do so below here. You cannot duplicate a specialty at the top, so I would not be able to add another entry of general practice with a different taxonomy. If I have another taxonomy that is related to this general practice specialty, I would simply just add a taxonomy below here by hitting the Create New button. That's going to bring up a new window for me, and I can choose from the drop down to add another taxonomy related to that specialty. Once you have recorded all of your specialties and taxonomies, you can hit Save to continue. The next page of our application is the service location page, and this is where you're going to report any and all service locations that you practice at. So we're going to first start by hitting the Create New button to open up a new window. And this is going to bring up a blank service location form for us. And just like our specialties, you have to have a primary location. So I'm going to select the checkbox to make this my primary location. And I'm going to call this our individual test today. I do need to enter in contact information for this service location. So now this contact information may be different than the contact information that you entered in on your first page. That was for this application specifically. What we want to know here is who do we contact if we need information at this specific service location. So I'm entering in the information with a name and a address. I'm going to tab through that, and I will select the changes. And then again, it's not required here that you enter in an email address, but we do recommend doing so because any notifications that we need to send to this service location, you're going to get that information much quicker by email versus mail. We do need to enter in a phone number, so we're going to hit Create New on this field in order to enter our phone number. And we're going to enter in a work number today. If you have an extension, you can enter that here, but it's not required. And I'm going to hit Save. If you have multiple phone numbers that you want to report here, you simply just repeat that process, hit Create New again. You'll get a blank form, and you can go on and enter in as many phone numbers as you would like. Just below that, you are going to need to report your hours of operation. So you're going to check the box that's to the left of hours of operation, which is going to open up a new window for you. You're going to hit Create New. And this is where you're going to let us know your hours of operation. So you have a few different choices when you drop the box down for day. You can choose every day, you can choose specific days of the week, you can choose weekdays or weekends, however you want to report it. So if Monday through Friday you have the same hours, you may want to choose weekdays to report that every day you're open from this time to this time. But if it varies, you can select specific days and really drill down to the exact information of when your facility is open. So I'm going to choose weekdays for today, and I'm going to say that we are open from 7:30 to, oh, let's go to 4:30. And then I'm going to hit save. So now I have an entry here. And again, if you have specific days, specific times, you would just repeat that process for as many times. So I could do Monday first with my hours, hit Create New again, Tuesday, and so on and so forth. We're going to ask you if the service is ADA compliant, if the service location is accessible by public transportation, and what are your after hours arrangements? What do you instruct your patients to do if you are not open? And so for today, I'm just going to note that we ask that they go to the ER. And then below that, we are going to ask if you are accepting new patients with special needs. If you are, you can check the box. If you have any age restrictions at your location, you can check that box. It will open up a new window and you are able to tell us the minimum and maximum age of your restrictions at your personal facility. If you don't have any age restrictions, you just leave that box blank. And then you need to let us know if you're accepting new patients. So you drop the box down. You can choose from yes, you are accepting new patients, you're accepting existing patients only, or you do accept family members of existing patients. So I'm going to say we're accepting new patients. And then lastly, do you have a preferred patient gender? Do you have female only at your office, male only, transgender, whatever it may be, or you can choose no restrictions. Once you've completed all the information, you can hit save. And now you'll see I have an entry for my primary service location listed here. And this satisfies the requirement for the service location information. However, you can report multiple service locations here. So if you have multiple, all you would do again is just hit create new, repeat that process, and enter the next service location. Again, the only difference would be that you're not selecting make it primary because you already have a primary on file. So once you've reported all of your service location information, you can hit save to continue. Next, we are on to the addresses page of our application, and this is where you're going to let us know the address and contact information for your pay to and mail to address. So first up is your pay to, and you do have the option to copy over your primary service location information. So if that information is the same, it's very easy. You can just check the box same as service location, and it's going to populate the information for you so that you don't need to re-enter it. Of course, if this information is different, you would want to just leave that box unchecked and fill out all of the necessary information. You can do the same here under email and phone number. If it's the same as the service location, check the box and it will carry it over. But if it is not, you can definitely feel free to write in an email address and phone number for who the contact is for your pay to address. Next is the mail to, and you have the same option. If you drop the box down here, you can choose to copy over your service location information. You also have the option to copy over your pay to. So if we had entered in different pay to information than our service location, but our mail to was the same as our pay to, we could copy that information over here as well. So you have a couple different options. And then of course, if your mail to address and contact information is completely different than either your service location or pay to, you have the option to just fill out the information here. I am going to copy it over from our service location. And then I'm going to do the same thing for our email and phone number for our mail to as well. And you will notice that when I did that, it populated the email and the phone number, but it also defaulted our preferred communication to mail. So you want to be really careful of that because, again, I'm going to recommend that you choose email. As I've stated a couple different times now, those notifications are going to come to you much quicker if you choose email. So just make sure that if that is your preferred communication method, that you switch that over to email. Further on down in this page, you do have the option to enter in different address and contact information for prior authorizations, remittance, legal, or medical records request. These are not required. However, if you have specific contact and address information that you want to record for these specific fields, you definitely can do so. All you would do is click the plus sign on the address and contact information that you want to complete, and that's going to expand your entry and give you the opportunity to fill in the information. You'll notice that nothing is asterisk here because these are not required fields. However, if you start filling out one of these fields, you have to fill out all of the information within that address in order to continue. For example, for the prior authorization, I wouldn't be able to just put in a name here and leave everything else blank. It won't let me continue. So if I start filling out any fields, I have to fill out all through the phone number in order to be able to continue. If you don't want to fill out any of that information, you don't have any unique address or contact information for these fields, you simply leave them unchecked and you can move on. But once you've filled out all of the required information, you can hit save to continue. We are on to the capacity page of our application, and this is where you're going to report how many Medicaid members you are able or willing to see per specialty. So you'll notice here that I only have one panel to fill out, and that's only because I entered one specialty under the specialties tab earlier on in the application. But if you report in multiple specialties, you're going to see a panel for each one of those specialties, and you'll need to complete this process for under each one of those panels. So very simply, all I'm going to do, you'll notice here that I have an entry started for me already. So I'm simply going to edit that entry with the pencil icon here. And all I need to do is type in the maximum number of Medicaid members I can see per specialty. And then I'm going to hit save. And again, if you have multiple specialties, you're just going to repeat that process under each panel. And once you've entered in all of the necessary panels, you can hit save to continue. Our next page of the application is organizational details. So the first thing we're going to need to do is we're going to need to select our organization type. So you're going to use the drop-down box here and select the applicable entry for your situation. And next is our tax classification. So I'm going to do the same thing. Use the drop-down. I'm going to select the appropriate entry. And then if one of these applies to you, you're going to check the box next to it. So if you're registered with Secretary of State, incorporated, chain affiliated, operated by a management company, or domestic or foreign owned, you would check the appropriate box. You can learn more about this by visiting this site here. If you do choose registered with Secretary of State or incorporated, you'll want to make sure that you add the appropriate date to the right of that field. Once you've entered in all of your organizational details, you can hit save to continue. We have come to a new feature of our individual application, and this is the associations page. Before I start discussing this page, I want to make it very clear that this is not a requirement of an individual application. This is a feature to allow you to also enroll as an individual within a group if it applies to you. But if it does not apply to you and you are solely an individual provider, you do not need to fill out the information on this page. So as noted, this is intended if you work as an individual provider, again, meaning that you are the billing and rendering provider, but sometimes you also work for a group as a rendering provider. You can report that information here and it will enroll you upon approval as an individual and an individual within a group so that you don't have to complete two separate applications. You can do it all on this one application. So if that applies to you, you first want to make sure that the group that you're going to associate to is actively enrolled. If they're not actively enrolled with Vermont Medicaid, you're not going to be able to pull them up and associate them to you. If they are also enrolling at the same time, you just want to make sure that their enrollment goes through first so that you will be able to find them on here and be able to pull up that record. If they are already actively enrolled and you're ready to associate, let me show you how to do that. So the first thing I'm going to do is I'm going to hit Create New, and that's going to bring up my association page. And I have two different ways that I can look up this group to associate to. I can use the 14-digit service location provider ID, and if you don't know what that ID is, that is available on our provider lookup on our vtmedicaid.com website, so you can find it there. And remember that groups sometimes have multiple service locations, and if that's the case, they're going to have multiple provider IDs, so you would want to select the provider ID for the service location that you are associating to. You do also have the option to look that up by MPI. And what that will do is it will pull all associated service locations for that group MPI. So then you'll be able to choose which one you want. So I'm going to show you how to do that with the MPI first. So I'm going to enter in an MPI, and then I'm going to hit the search bar. And this has brought up two of the service locations because this group has two service locations for this actively enrolled NPI. Again, if you're entering an NPI and nothing is coming up, the chances are is that they're not actively enrolled in Vermont Medicaid, which is why you can't find them. So I'm going to say, and maybe you are associated to both of the service locations. So maybe you go to both service locations to practice sometimes. We can associate ourselves to both of them. We just have to do one at a time. So I'm going to select the first one first, and that is going to pull over the information. I have to enter an effective date of when I started practicing there. And it's going to automatically default the end date to what we call the end of time, 12/31/9999. We're assuming that you don't have an end date with that group at this time, but of course, if you do, you can feel free to enter and change that end date to whatever that date may be. When that date comes and goes, the system is just going to terminate that association for you. So I'm going to hit save. And now you can see I have associated to a group that is actively enrolled in Vermont Medicaid. So when I submit my application and it is approved, I will not only be enrolled as an individual, but I'll also be enrolled as an individual within a group. Now, if you want to report another association, you can simply do that by repeating the process, hitting create new. This time I will enter in the service location. So I'm just going to enter in the second service location for this group here. Hit search, and it pulls the information the same way as it did before. I have to put in my effective date, and I'm going to leave my end date as is. Then I can hit save. And now we have that second association. So you can associate yourselves to as many actively enrolled service location IDs associated to any group. The groups do not need to be associated to each other. It really can be any group that you are affiliated with. Again, though, this is not a requirement on your individual application. This is a feature intended to allow you to enroll as both without having to do separate application if it applies to you. If this does not apply to you, just hit save and continue and move on. Don't fill anything out. But if it does, go ahead and fill the information out, and when you're ready, you can hit save and continue. We are on to the credentials tab of our application. The first thing that's going to present itself here is the degree information. This is not required, but feel free to enter this information if you would like to report it. You would just hit create new and then enter in the degree, school, and year of graduation. You will be required to enter in a license, so we're going to do that now by hitting create new. We're going to open up a new panel. You're going to need to enter in your license number, the issuing state, the issuing board, and your effective and end dates of this license. And hit save. And now I have satisfied that requirement. If you have multiple licenses, maybe you hold different licenses in other states, you can simply report that here by hitting create new again and just repeating that process. We've come to the Medicare participation panel, and if you remember from earlier on the first page, I did select yes that I am participating in Medicare, which means I have to fill this information out before I can move on. So I'm going to hit create new. And I'm going to report my Medicare information. The first thing I want to do is I want to check the box to be considered for Medicare crossover claims. I need to enter in my Medicare number, and I need to select a Medicare type. So I'm going to choose that I'm enrolled in Medicare Part A today, but I am also enrolled in Medicare Part B, so I'm going to have to do two entries here, and I'll show you that. So I'm going to choose Part A first, and I'm going to enter in my effective and end dates with Medicare. I'll hit save. And now I'm going to go back, hit create new again. Again, I want to be considered for Medicare crossover claims. This time I'm going to select Medicare Part B, put in that effective and end date, and hit save. So just repeat that process if you are enrolled in several different Medicare types. Right under that, we're going to ask you if you're enrolled in any other state Medicaid program. If you choose yes, a box is going to open up and you will be required to give us the program, the state, effective, and end dates of that enrollment. If you are not, you check no, and there's nothing else for you to complete. If DEA is applicable to you, you can simply hit Create New, enter the DEA number, effective and end dates, and save that information. However, this is not a required field, so if this does not apply to you, you can simply move on. When you've entered in all of the required information, you can hit Save to continue. The next page of our application is related to provider type, and we just have two questions here. The first question is asking if you're applying as a primary care provider, so you can choose yes or no here. I do want to just note here that if you do choose yes, you are still going to need to go out to the vtmedicaid.com website and fill out the PC Plus agreement form that is out there. So I just want to make note of that to make sure that you go out and take a look at that if you are stating yes, you want to be a primary care provider. If CLIA is applicable to you, you can fill out this information. You just hit Create New, give us the CLIA number, type, effective, and end dates. But if this doesn't apply to you, you are all done on this page and you can hit Save to continue. The next page we have to fill out is the other page, and we're going to start by reporting any languages spoken at our service locations. So I'm going to hit Create New, and very simply, I'm just going to choose from the drop-down box here. I'm going to choose English first. I'm going to hit Save, and now I have an entry here under Languages. And you're just going to repeat that process for however many languages are spoken at your service locations. If you have any certifications that you want to report, you can do so here, however, not required. You would hit Create New, give us the specialty, certificate type, number, and effective and end dates. Also not required, but you can report if you have a website that you want to be able to be available on the provider directory. You can report that here. Please just make sure that you are starting that URL with HTTP or HTTPS in order to make it valid. You will be required to provide malpractice information, so we're going to do that by hitting Create New. And we're going to select our type of carrier first, the name of the carrier, our policy number, our coverage amount aggregate, as well as our per occurrence. Now you'll notice when I entered in these two amounts, I did not use any special characters, no dollar signs or commas or periods. The module doesn't allow for those special characters, so just leave those out. Just strictly stick to the digits in this case. And it also does understand that the aggregate should be more than your per occurrence. So if by mistake you happen to switch those two numbers around, it's not going to let you continue. It's going to stop you. So then we're going to put in our effective and our end dates of this policy. And we're going to hit save. Directly under that is going to be a question of whether you are currently or in the last 10 years been involved in a malpractice suit or claim. If you choose yes here, a new window is going to populate and you are going to be required to give us information regarding that suit or claim. You're going to need to give us the patient name, the policy number, and your status in the suit or the claim. If the answer is no, there's nothing else to fill out and you can move on. Lastly, not required, but if you wanted to report a medically related organization, including labs or home health agencies, you can do that here. Just hit Create New, give us the name and the address. Once you fill out all the required information, you can hit Save to continue. We are on to the EFT page of the application, or electronic funds transfer. So we are asking here if you wish to have direct deposit for payments from Vermont Medicaid. So you'll see here that we just have one question to start off, and that is, do you wish to enroll? It's going to default to no, and if your answer is no, you can simply hit save to continue and move on, and you will receive a paper check. But if you would like to enroll in direct deposit, you can choose yes, and this is going to open up some information for you. It's going to carry over in the top section under provider information, information that you filled out earlier in the application. So just look that over and make sure everything is correct. It's also going to pull over some identifier information. So same thing, look over the information and make sure that is correct. There's nothing for you to fill out in these two pieces of information. It's already pre-populated for you. Directly under that, the provider contact, agent, agency, and retail pharmacy information are not required, and that's why they are collapsed. But if you have information in there that you need to report, you can absolutely do so. It's the same as on the addresses page. You're going to click the plus sign on the line item you wish to fill out and fill out all of the information that's within that panel. But again, if you don't have anything in here to report, these are not required. You can leave them collapsed and move on to the next page or to the next panel. You will be required to fill out the financial institution information. So the first thing we're going to fill out is the bank name. And then under that, we're not requiring that you fill out the address for the bank. You can if you choose to, but this is not a requirement. You are required to tell us which type of account it is, so you can choose from checking or savings. And then you do need to give us the account number and the routing number. Directly below that, you can choose to be linked by tax ID or NPI. You can just toggle between those two. And then the last panel on this page is under submission. And you are going to need to tell us on this first drop down whether you're going to send in a voided check or a bank letter as documentation. You are required to include one of those with your application. So select either voided check or bank letter. And then we do need an electronic signature of the person who is submitting the enrollment for EFT. So this may be a different signature than the person who is submitting the application. This is whoever is authorized to sign for the EFT information for your organization. So a name goes in there. And then lastly, you'll need to choose an effective date of this enrollment. Once you have entered in all of the necessary information, you can click Save to continue. Next, we're going to fill out the disclosures page of the application. And it's really important that you read over the top information under Privacy Act Notice Statement, Ownership and Controlling Interest, and Disclosure Forms. That's going to give you some more information about what we're looking for here. Every provider is required to fill out a provider self-disclosure. So we will need to create new and fill out this disclosure form. Under that, there's four other disclosing entity types that we're going to need to action. It doesn't necessarily mean that you have those disclosing entities or it qualifies in order to have to report, but we do have to action saying yes or no in order to continue. So right now, all of our statuses are new, and we need all of these to be completed in order to be able to move on. So the first thing we're going to do is we're going to start with our provider self-disclosure. In order to fill this form out, I'm going to hit Create New, and that's going to populate a brand new provider self-disclosure form for us. At the top of the form, you're going to see your information pulled over from earlier on in the application. Always a good idea just to make sure the information is correct. And then below that is going to be a series of questions that you're going to need to read over very careful and answer accordingly. I'm going to make an example of this first question here. This one says, has any action ever been taken against your license? You'll notice that everything is defaulted to yes. So if your answer is yes here, you are going to need to fill out more information in the box below it as to why you are saying yes to this this question? What about this question is making you say yes? What is the more information here? If your answer is no, that box is going to go away and you can move on to the next question. So I'm going to go ahead and answer the questions as I have already become very familiar with them. I'm going to answer them according to my situation while you do the same. About halfway down on our page, we're going to ask you for a couple pieces of information. And the first one is going to be contact information in the event of an audit. Who do we contact? So again, this contact information may be different from any other contact information you have reported so far on this application. Who do you want us to contact if we have more information that we need for you regarding an audit? I'm going to tab through and let the USPS software work. Select the changes, and then I also need to enter in a phone number for the same contact information. Directly below that, we are going to ask you for an address of where your records are kept. And it's going to note here that you can't enter a P.O. box. And for obvious reasons, we do not expect that your records are being kept at the post office. So you do need to enter a physical location of where your records are. So I'm going to enter in that address, select the or accept the changes, and then also a phone number of if we have questions regarding medical records, who do we contact? Under that will just be a few more questions for you to answer, so you can answer those appropriately and accordingly. Once you've answered all of the questions and entered in all of the contact information, you can hit save on this disclosure form. And now you'll notice that the status for our provider self-disclosure is completed. We have satisfied that requirement, and the create new box is now grayed out because we can't do more than one self-disclosure. So we have to move on and action each one of these other disclosure forms. So we're going to start with subcontractor. So just like our self-disclosure, I'm going to hit create new. And this is going to bring up a blank subcontractor disclosure form. The top of the page is going to describe to you what a subcontractor is and what the criteria is. So what you're looking for is, do you meet the criteria in order to have to report this information? The first question is going to ask you if you do or not. So for instance, it's going to ask you, have you had any business transactions with any subcontractors totaling more than $25,000 in the last 12-month period? If your answer to that is yes, you will need to fill out the information for each one of those subcontractors. So we do them one at a time. So if you only have one, you only fill out one of these forms. If you have more than one, you fill out a form, save it, hit create new again, and fill it out again. If you do not have any subcontractors that meet this criteria, you simply answer no to that first question. Everything else disappears and you can save it. And now you have met the criteria or the requirement for the subcontractor disclosure form, and it is now completed. But again, if you filled out the form because you did have a subcontractor that met that criteria, but you have more than one, the Create New button is still available. You can go back in, start a new form, and then report the next subcontractor that meets that criteria. We're going to do the same thing for ownership and control interest. We're going to hit Create New to get a blank ownership form. And again, we're going to read the top of this to see what the criteria is in order to report. Your first question is going to be tailored to ask you if you meet the criteria or not. If yes, same idea. You're going to fill out all of the information in order to complete the form. If your answer is no, you select no. That information goes away and you can hit save. And now I've met the criteria. I'm going to do the same for managing employees. I'm going to read over the information at the top to make sure I understand what it means by managing employee, and then I can answer that first question accordingly. So again, yes or no, yes, you're going to fill out all of the information and answer the questions. No, you hit save and move on. And then lastly, I'm going to do the same for business transaction. I'm going to hit no, and I'm going to hit save. So I hit no on all of these disclosures today, just for time purposes. But if you have subcontractors or owners or managing employees that meet that criteria, you are required to disclose that information. And each one of those disclosing entities gets screened in your application when you're going through the enrollment process. So you must report them. I want to make that very clear that I only chose no today just for time purposes. You want to pause this video and report all that you need to before you move on. The last thing that I want to note is that if you need to go back and look at your disclosure form, maybe you filled it out, but the provider themselves needs to go and review the information before you submit it, you can take a look at that by simply clicking anywhere in the line item for the form that you want to look at. So we only have a provider self-disclosure form on mine, so I'm just going to click in this line item just once, and that's going to bring up my disclosure. You can look at it by hitting the edit button, and it will bring up all the information that you filled out. You have the option to change it if you need to, review, make changes, whatever you need to do before you submit the application. Once you have filled out all of your disclosing entities, you can hit save to continue. The next page of our application is the attachments page, and this is where you are going to need upload documentation that is required per your enrollment type and your provider type. So you're going to notice here on my page, because I'm an individual physician, I am going to be required to submit a W-9, a professional license, proof of professional liability insurance, and a copy of a voided check or a signed letter from the bank for my EFT enrollment. So right now, all of the requirements are no, and we need them all to say yes in order to continue on. And how we're going to do that is in the panel below under attachment details, we are going to create entries that either have the file uploaded in them, or we're going to say that we're going to submit the documentation separately. So let's start by showing the first one here for the IRS W-9 form. So I'm going to hit create new for my first entry. And the first thing I need to say is what is my transmission method. So if you drop the box down, you'll see you have a few different options. I am going to recommend that you submit these electronically if and when possible. And the reason for that is if you upload your documents directly to the application, when you submit your application, it immediately goes into our screening service for a Gainwell clerk to start processing. If you choose to get your documents to us by mail, by email, or by fax, when you submit your application, it's going to go into a holding status waiting for those attachments. And there is a time limit on you getting those attachments to us in order for us to upload them for you. So it does cut down quite significantly the processing time if you can upload them right to the application yourself. But again, you have the option to submit them to us another way. Just be mindful that when you do that, you need to get those documents to us as soon as possible. So I am going to choose electronic for today. And I need my attachment type to match my attachment types over here. So there's lots of different options to choose from. I'm going to do a predictive search and just write in IRS. And here is my IRS W-9 form. Because I'm choosing to do electronic, I need to select files to go find the file on my computer in order to upload. So you're just going to navigate to the file on your computer, and you're going to upload that document. And just that fast, it's done uploading, and I can hit save. And so now you're going to see that I have an entry here for my IRS W-9 form with my actual file. And now up top, under required attachments, the IRS W-9 form requirement has been met. It says yes. So I'm going to do the same with my professional license. I'm going to go down to the attachment details, hit create new. I'm going to choose electronic for today, and I'm going to go find my attachment type, and this time it's my professional license. I'm going to navigate to the file on my computer. And hit save. And my second one is now complete. I'm going to do the same for my proof of professional liability insurance. Choose electronic, go find that specific one, and select my file. And then lastly, I just need to attach my copy of the voided check here. So I'll do my last entry. So you can see how fast this goes when you have the information ready. And that's why it's important to really take a look at that first welcome page or that enrollment pre-checklist, because it's going to give you the information of what you're going to need. And if you've got it ready and everything is on your computer already, this is a very, very simple, easy, efficient process. I don't need to go searching for everything. I've got everything right here waiting to be uploaded or information to be inputted. So I now have met the requirement for each one of these document types, but I do want to just make sure that I'm noting that a requirement met of yes here does not automatically mean that you've uploaded the document. It just means that you have told us how you're going to submit the documents to us. So if you chose mail, email, or fax, it's still going to say yes up here. You're just meeting the requirements to move on to the next page. But if you chose mail, email, or fax, just be mindful that you're going to need to access that cover sheet at the end, which I will show you, and you're going to need to send those documents to us as soon as possible. Once all of your requirements have been met, you can hit Save to continue. And the last page of our application is the Agreement and Submit page. This is where you're going to electronically sign the terms of agreement for Vermont Medicaid. So you want to make sure that you're reading over the information very carefully on this page. You'll notice here under Terms of Agreement that my information has been pulled from earlier on in the application. Again, I've said it several times. You just want to make sure that the information is correct, because now is the time you're going to want to change it if it's not correct. There are special provisions for certain provider types with Vermont Medicaid. So before you move on to the rest of this page, you want to access this blue hyperlink here, which is going to take you to those special provisions to check if there is one for your provider type. If there isn't, you can just navigate back here and proceed. But if there is, you're going to want to look over that information and become familiar with it. Once you have looked over for any special provisions, you can hit Proceed in the bottom right-hand corner. And this is going to open up the Vermont General Provider Agreement. You have the option to save this, to download this if you want to keep a copy for your records, but you do want to just make sure that you're reading over this information carefully, because these are the terms that you are agreeing to with Vermont Medicaid. Once you've looked over the information and you agree to it, you want to click the I accept box here in the lower right-hand corner, and then a blue box is going to come up just confirming that you do agree to those terms. Directly under that is going to be a place where you're going to enter in the portal registration details. Upon approval of your application, you're going to receive an invitation code to the online provider portal in order to maintain your enrollment information. So what we're asking for here is who should get that invitation code in order to be able to register. I want to make a note that whoever is entered here is going to get direct access to the provider enrollment information in this application. So whoever has the authority to do that, you can enter the information here, and again, upon approval, they will receive that invitation code. When they register their invitation code, they have to enter in the information exactly as it is in here, so you want to make sure the information is correct before you move on. And then lastly, we need to sign this application. So we're going to do that electronically. So to do so, you're going to click the I accept box, and then you're going to electronically sign with your last and your first name. If you need to provide any comments related to this enrollment application, you can do so here, but it's not required. And then we need to enter in an email address to get a verification code in order to submit this application. If you are not ready to submit your application, you have the option to come back and resume it and submit it at a later date. You would just click the Finish Later button, and this is going to save all of your progress. So maybe you need to have somebody else review it, or you're unsure of some information, so you're going to confirm it. Just be mindful, though, that if you do choose to finish it later, you have 30 days to submit your application. If you don't submit the application within those 30 days, the application is going to expire and you will need to start over. So just be mindful of the date when you are choosing to finish later. And you will get some confirmations and reminders in your email that it is going to expire. But if you are ready to do that today, you're going to enter in that verification email. And then you're going to click Request Verification Code. And what this is going to do is going to send a code to the email address that you just entered. And you have 10 minutes to use that verification code before it expires. So I'm going to click OK here, and I am going to go get my verification code in my email. So I've received my code, and I'm just going to paste it in here. So I copied it directly from the email notification that I received because it has to match exactly. So if it's capitalized, you have to make sure it's capitalized here. So the easiest way for me to make sure that it is the correct code is just to copy and paste directly from that email. So once you have all of the information completed on this page and you've entered in your verification code, you're now ready to submit. So you can hit the Submit button on the bottom right-hand corner. And it is going to confirm, are you actually ready to submit the application? We're going to check yes. So now we have successfully submitted our individual enrollment application. You will get this confirmation. You'll also get a confirmation email that it's been successfully submitted. It's going to give you your tracking number one more time. And then if you need to contact us for any reason, it's going to give us the contact information for our Provider Services Help Desk and the Provider Enrollment Team. Now, as I mentioned when we were in the attachment section, if you chose to submit your documentation by mail, email, or fax, you're going to want to print out and access this cover sheet in order to submit that with your documents. This cover sheet gives us the application tracking number and your contact information. So when we receive those documents, we can easily identify which application these are supposed to be uploaded to. So this reduces the time. We don't have to question who is this for. We're already going to know because we have that cover sheet. So just make sure that you are attaching that cover sheet to any documents that you send to us. Lastly, before we close off this presentation for today, I just want to show you that once you've submitted your application, you are able to check enrollment status at any time, and you can do so by clicking the menu button again, hovering over provider enrollment, and clicking enrollment status. All you're going to need here is your application tracking number and your password that you use to register your application with, and it will give you the status at any time during your enrollment process. Also, if you did choose to finish your application later and you need to resume your application, right above that is the Resume Revalidate Enrollment. So you would click on that, again using your application tracking number